I'm going to have you sit forward with your feet on the ground. Let me just see. Hold that for me. Grab this one here. Hold that for me. Just put your elbows up on the sides. That's a cool tattoo. Nice. So we're going to take this ace bandage off.
Thank goodness.
You can leave it off for a few hours, let your skin breathe. Once you put it back on later today, not as tight, just a little bit snug. And wear it for the next 2 weeks, taking it off only to shower.
Okay.
If you need to wash it, put it in a pillowcase, this way it doesn't get damaged. Bob Dylan did it, so we would tattoo his face on their arm.
I just saw him last May in concert, and I was hoping to meet him so that he could sign my arm, and then I would get that tattoo.
Did you get that tattooed on there?
Didn't work.
That'd be funny, huh? It would be funny if you signed like right on top of his face.
Yeah.
Oh, that would ruin the whole tattoo. I always joke around, so if somebody comes here with a tattoo of my face in their arm, I'm going to freak out. Alright, you leave. It's time to go. Bye-bye. I had somebody once send me M&M's, and they got them customized. They put my face on the M&M's. I'm like, how'd you get a picture of my face? I guess for our website or something?
Yeah.
So I was like laughing. I said, this is kind of scary, but funny. But it was kind of a neat gift. My kids had them all.
Maybe you can come on the front, over here on the shirt, stand against the wall if you want.
Nice tape like your skin.
Yeah.
Alright, not trying to hurt you. Just have to get this thing off. Yep, it's almost gone. There we go.
Did that side bleed extra?
No. It's normal. Okay. Alright, so why don't you stand up? Let's take a look together.
Wow, that looks amazing.
Looks very good. So you can see a big difference from before, obviously.
Yeah.
But you got a lot of ripples and wrinkles, and a little mild swelling. It's normal. This is all going to go away over the next several weeks. So don't worry about that. Any of the little bruising and stuff like that will go away with time too. The tape strips, leave these on for another week. If they don't fall out by next week, you can peel them off. That's just okay to start to use the scar guard and the incisions. Nipples where it should be. It's in the lower outer border of your pec muscles, exactly where they are. On the sides, lift your arms up. A little puffiness here, so we did do some liposuction, but again, once this goes down, this should look pretty natural, like it's part of your body, as you can see. There's no dog ears, not a lot of huge excess skin or anything like that. Okay, so it actually turned out very, very well. Okay?
Better than I expected.
Alright, let's get your drains
Can
up.
you look at me real quick so I can take a picture? Can I take a picture of the two of you standing together?
Yeah, want me to stand like this?
Yeah, that's awesome. Oh, God, it's so amazing.
Alright, let's take your drains out. Get these things off. And
Not never seen more, baby.
That's good. Back all the way. Like that, perfect. I'm going to raise you up.
I think the hardest part is just not knowing what it looks like under there.
It's a reveal for me too, because you understand when you're on the table, when I'm doing it, it looks great on the table. So I'm like, well, how's that going to look when he stands up?
Right.
It's totally different. So it varies from patient to patient. Most patients look pretty good.
This is me.
Yeah, it's pretty amazing. Like when you're on the operating table, it's such a different appearance.
Yeah.
And it comes just with experience doing just hundreds and hundreds of these surgeries.
How many do you think you've done, Dr. G?
I can't even count. It's got to be in the thousands by now. It's I mean, I guess I could run the numbers on my system here. I do on average about 500 a year. I know I did over 500 last year. So if you steadily getting busier and busier, we're at the point now where I can't do more. It's not physically possible to actually have a life. So I've got kids. I got to spend time with my family, so I can't work constantly. Remember Ferris Bueller said you got to. What did he say? Something about life? He says you got to stop and take a look around because life goes by really quick. Go ahead and turn your head that way. Take a deep breath. Blow out. There's your out. I think I got that quote totally wrong, but it's pretty.
It's relevant.
True. Yeah. You're gonna wake up 10 years from now. I wonder what happened in 10 years. Take a deep breath. Blow out.
Who
You felt that one?
Oh my god.
Oh, just relax. Take deep breaths. Deep breaths in and out. Burning sensation is going to go away in a second. Just take deep breaths and just relax. Don't tense up. If you tense up, it actually lasts longer.
Is that because I like pulled on it?
Because you what?
Because I yanked on it? Or in my sleep?
No, it could maybe it irritated it. It could have done that either way.
That so hurts.
Yeah, well, here's the good sign is that it's, I'm not sure what that is, a guitar pick, I think, fell out of your pocket?
Yeah.
Okay, just kicked it out of the way, sorry.
Oh gosh.
It just could be that you're more sensitive on this side, the nerves are still intact on this side, so you just feel more, okay?
Wowie.
Now there's a small hole at the end of the incision. I just covered it with a bandage and some antibiotic ointment. You want to do that once a day for the next week. It takes about a week for it to close up. And it's going to leave fluid. That's normal. Okay?
What are you doing now?
I'm taking the dressings off the nipples. So the nipples always look gross. The outer layer of skin is going to peel away. New skin cells will grow over on top of it over the next couple of weeks. And then the nipple projection will return after several weeks. So
Is there stitches in it?
yeah, it's going like Franken nipple.
Will they just dissolve?
Yes, yes. I'll show you in a second here.
That was crazy. The first drain, I didn't even feel it. The second drain felt like it tore part of me out.
You know what? You have one side that hurts, one side that doesn't sometimes. It's just how it is.
I guess that's why that side hurt more.
Go ahead and take a look down. Here's the areola. Nipples in the center. Little brown sutures in the periphery. These are all going to fall on their own. If you get any bleeding from the edges, that'll stop after about there. So.
Can I zoom in on that?
Come
Can I come over there?
Oh yeah, if you want to take a picture real quick, yeah.
They look good, baby.
I do.
The cinematographer here.
She's got one for video and one for pictures.
That's crazy, huh? This one's great too.
Wow, that's just nuts.
Can I look at them before you cover them back up?
Yeah, it's gonna be kind of it's kind of hard
That's okay. I'll just see a picture.
because I'd have to lower the table, sit you up, and put you
That's
back there, and
They look,
they look really good.
yeah, they look awesome.
So you can start showering tomorrow.
Thank
The water
God.
hit your back, run over your chest. Do not face the shower jets because you could damage your nipples. When you get out of the shower, you can pat yourself around with a clean towel. That's when you do the dressing. So I'm going to give you 2 sheets of yellow gauze called Zero Form. They're in these foil packets back here. You're going to do this dressing once a day for 3 weeks. So what you're going to do is you're going to cut 2 small squares like this. You're going to put one on top of each graft.
That's like the stuff they gave me when I cut my fingertip off.
Mm-hmm.
Yeah,
It is the
Zero
exact
Form.
same stuff.
Same stuff, yep.
Yeah.
And I'm going to put some antibiotic ointment on this. Just put it on the top and just gently spread it in place.
Does he have to wear gloves during this process?
I would recommend it.
Okay.
Wash your hands, put gloves on, once a day for 3 weeks.
Should he do it so he knows how hard he's doing it, or can I do it?
You can do it.
Just do it gently.
So I'm putting gauze on top. I recommend getting those big old square Band-Aids. Peel them open, put them on top. That's that.
He can't have that adhesive.
Do you have anything that you can use, like maybe just paper tape and gauze? Can you just do that?
Paper
Like I'm
tape.
doing now?
Yeah.
Then do this, what I'm doing now. Gauze and tape.
And the big, wide paper tape,
Yep.
just over the whole thing.
Just kind of holding the gauze in place, that's all.
Okay, so
Yeah,
top and
pretty
bottom.
straightforward.
Okay.
I mean, you can see your skin didn't react to this tape at all, which is fine.
Oh.
Yeah, you didn't get welts or anything like that. So
Thank you so much for doing such a good job.
Oh, you're welcome. Now listen, for the next 2 weeks, take it easy. Arms down by your side, wear the ace bandage. No strenuous activities, no heavy lifting. After 2 weeks, you can use your arms a little bit more, but still no heavy lifting, no exercise for 6 weeks. Okay. If you want, ask Jessica to print you out a brand new post-op instruction sheet. I kind of revised it last week since you guys have been here. I was trying to update it so it makes a little bit more sense as far as legit, like when you do this, when you do this. If you don't want to wait for that, you can download it from our website. It's on there already. Okay?
Okay. Thank you, Dr. G.
All right.
When can I have sex?